Hi, I am Nakisha Scantlebury Fortune, and welcome to our fourth episode of the Arouca SCA Church Health Ministries Health Nuggets series. In our previous episodes, we have covered what is diabetes, causes of diabetes, signs and symptoms of diabetes. But let's take it a step further. In this week's episode, I would be presenting tests for diabetes mellitus and how to get tested. The biggest question is, should I get tested for diabetes? Are you experiencing symptoms of diabetes? For instance, excessive thirst, unexplained weight loss, frequent urination. Are you over 45 years of age? Does your mother, father, or any other close relatives have diabetes? Are you overweight? Do you have diabetes during your pregnancy? Have you had large babies weighing more than 9 pounds at birth? Are you hypertensive? If you answered yes to more than one question, visit your health center or your doctor and have your blood sugar level checked. Testing allows healthcare professionals to find diabetes sooner and work with their patients to manage and prevent complications. What are the tests used to diagnose diabetes? Our first test is the fasting plasma glucose test. So in the fasting plasma glucose blood test, this measures your blood glucose level at a single point in time. For the most reliable results, it is best to have this test in the morning after you fast for at least 8 hours. Fasting means not eating or drinking anything before this test. Diabetes is diagnosed when at least 2 separate blood tests show that your fasting blood glucose level is greater than or equal to 126 milligrams per deciliter. So in this diagram here, you see that the green zone, that's the normal zone, your sugar test should be less than 100 milligrams per deciliter. Pre-diabetes, greater than 100 milligrams per deciliter, but less than 125 milligrams per deciliter. And in the diabetes zone, greater than 126 milligrams per deciliter. Another test that is used is the HbA1c test, or it's also called A1c test. The HbA1c test is a useful blood test that can be used to diagnose diabetes and also to monitor blood glucose control in persons with known diabetes. An HbA1c blood test can give an indication of whether blood glucose levels have been higher than normal over a period of 3 months. It looks at how much blood sugar or how glucose is bound to the red blood cells. So the HbA1c test is a simple blood test. There's no need to fast before this test. You are allowed to eat and drink as normal. The results should be available within a 24-hour period. So the A1c test results are reported as a percentage. A higher A1c percentage corresponds to higher levels of blood glucose. Results for diagnosing are interpreted as follows. Below 5.7% is normal. 5.7 to 6.4 is diagnosed as prediabetes. 6.5% or higher on 2 separate tests indicates diabetes. Oral glucose tolerance test. The oral glucose tolerance test can be used to screen for type 2 diabetes. The oral glucose tolerance test is also used during pregnancy for diagnosing gestational diabetes. And gestational diabetes, that's a type of diabetes that develops during pregnancy. So for this test, it is done between 24 and 28 weeks of pregnancy. Blood sugar levels that is higher than normal early in pregnancy may indicate type 1 or type 2 diabetes rather than gestational diabetes. The Ministry of Health recommends testing for diabetes in early and in late pregnancy. So how do you do this glucose tolerance test? So you'll have to fast overnight before the test and have your blood drawn to determine your fasting blood sugar level. Then you will be given a sweetened drink containing 75 grams of glucose. After having this drink, a further blood sample is taken after 2 hours. After 2 hours, a blood sugar level of 140 milligrams per deciliter or lower is considered normal. 140 to 199 milligrams per deciliter indicates you have prediabetes, and 200 milligrams per deciliter or higher indicates you have diabetes. Another test that is done is the random blood glucose test. Random blood glucose testing measures the levels of glucose or sugar in the blood at any given time. A random blood glucose level of 200 milligrams per deciliter or more may likely indicate you have diabetes. So the normal levels for the random blood sugar test are 70 to 140 milligrams per deciliter. Prediabetes, 140 to 200 milligrams per deciliter. And to determine diabetes, greater than 200 milligrams per deciliter. So this chart shows the various tests that were mentioned and their values, the different range, whether it be normal, prediabetes, or diabetes. It is important to note that to diagnose diabetes, you generally need to have 2 elevated fasting blood sugar results. Any abnormal diabetic test needs to be followed up with a doctor. Please note. So the question is, after all of these different history checks, you want to know, where can I go to get tested for diabetes? Where do I go? So a simple blood sugar test could alert a person to an elevated risk for diabetes before serious symptoms and signs of diabetes begin. Free blood sugar checks are available at all health centers throughout Trinidad and Tobago. Free blood sugar checks are also available at various health fairs within the community. Blood sugar checks can also be done at private pharmacies nationwide. All public and private hospitals offer testings for random blood glucose, HbA1c, glucose tolerance tests, and fasting blood sugar tests. The Diabetes Association of Trinidad and Tobago, they also offer HbA1c testing at an affordable cost. If you are a diabetic patient, it's important for you to have your glucose monitored on a daily basis. Daily blood glucose levels should be recorded and be presented at each doctor's visit. This is important to provide healthcare providers with information on how well you are managing your glucose levels, and this aids in your plan of care. Random blood glucose levels are done at every doctor's visits for diabetic patients. HbA1c blood tests should be done every 3 months to determine how well your blood glucose levels are maintained, or as indicated by your doctor. It is important to check your sugar levels frequently and visit your doctor at regular intervals. Screening and prevention of diabetes is the only way to curb this deadly disease, and there's no one better than you to take ownership of your own health and well being. Beloved, I wish above all things that thou mayest prosper and be in good health, even as thy soul prospereth. And this was taken from 3 John 1:2. Thank you for watching, and God bless.